Today we're fortunate because we get to speak to a doctor, specifically a gastroenterologist. And for those of you out there who've maybe never been to a gastroenterologist or don't even know what that is, well, if you want to know more about that, stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. Yeah, my guest today is a doctor. It's Dr. Douglas Weinstein. Good morning, doctor, and thanks for being with me.
Good morning, Andrea, and thank you for the invitation.
Well, I appreciate, you taking your time to be with us this morning. And, as I said, I think there's lots of people who might not even know what a gastroenterologist is. But before we get into that, would you kindly just introduce yourself a little bit and explain to us what you do?
Sure. So I have been in the area now since last year, the end of last year. I'm at Jersey Shore University Medical Center, and I am the director of the GI motility program here. So I focus particularly on trying to help people who have conditions of the movement of their GI tract. And this is what I've been doing now for the past more than 10 years because it's a condition that a lot of people suffer from, and try to help other GI doctors help their patients with these conditions as well as help my own patients with these conditions.
And of course, I will put all of the doctor's info and contact info in the notes. So if you want to reach out to him, you don't have to memorize anything. So, first, can you just explain the field of gastroenterology for people who might not have a good feeling about it? How would you describe that?
So gastroenterology is really trying to help people who have conditions anywhere from the top of their throat, where the esophagus begins, all the way to the bottom at the outlet, the anus, um, and any conditions that can occur anywhere in that long tract that spans more than 30 feet. We try to help people with, and they could be conditions where there's something you can see with a camera, or there could be conditions that you cannot see. And these are treated by medicines or by different types of other therapies. It could be done through uh, diet, through lifestyle changes, sometimes even through different changes in people's mindset, as well as surgeries, of course. But there's more and more therapies in this area. It's an area that there's a lot of advances every year to try to help people.
So, I'm going to just focus on one of the things that you said 30 feet of intestines coiling around there, about 30 feet.
Yes, it's a very long
That's
job
pretty
of plumbing.
remarkable.
We're all plumbers in this area, and there's a lot of pipes that we have to work on as plumbers for this part of the GI tract. But not only is there the plumbing, the pipes, but there's also that electricity. Plumbers don't usually have to work with electricity, but we have electricity. God put electricity in our pipes as well, and muscles too. And you don't see that in pipes. So
Yeah.
it's much more complex area. We have a much harder job than plumbers do. And, God made it that way because it has to handle digesting our food and eliminating waste for many, many years with minimal uh, upkeep. And
Right.
of course, plumbers have to do a lot of upkeep all the time, but our God designed our GI tract in an amazing way that it really doesn't require much upkeep.
Well, and that's a good thing. But what are some of the most common conditions that you see in folks?
There's very common conditions that most people are already aware of, like heartburn, that almost everybody experiences if they eat too much or eat too late at night or have things that are too spicy, too much coffee. Those are very common. A lot of people don't even realize that they're just drinking too much coffee and causing their heartburn. And constipation is the other extremely common condition that almost everybody has experienced to some degree or another, whether they took a plane flight and they didn't drink enough water,
Mhm.
or they have been having other conditions that have caused them to not go enough. And these are conditions that there's many different treatments for, whether it's people finding their own treatments at home or getting bad enough where they have to seek out help.
Well, that's really the next thing is what are the symptoms that to be really aware of that would make people say, "Wow, I better do something about this." And you know what? Before you were talking about heartburn, or basically you're starting up in this part of the body, at the top, and I'm thinking that some people don't realize that that is a gastro situation because it's here, it's up here, right?
Right. Yeah, some people might wonder if it could be their heart since it is in that area, and sometimes it is, especially in women, because sometimes their symptoms are different than the typical heart symptoms. Men usually have the symptoms more typically with the chest pain when exerting
Right.
themselves or crushing chest pain, things like that. But sometimes women don't have those symptoms when it's a heart problem, and they might have more of a heartburn or a other type of a chest pain. Even men too sometimes, but less commonly. So that's why we always make sure patients have seen a cardiologist to make sure that their condition is not heart related. Of course, that's going to be much more important to treat quickly and get
Right.
evaluated than a GI condition that is going to be less life-threatening.
Well, what are some of the symptoms? Let's go back to that people have to realize, whoa, I better make an appointment with the doctor. This is not a normal thing.
Yes, so from the top, first of all, heartburn that is not related to the heart, but not getting better with whatever treatments they're using, or it's persistent and just continues and really interferes with their daily activities, just is not going away, or they're requiring a lot of medicine to try to treat it, a lot of Tums or a lot of Rolaids every day, things like that, that just it won't go away. Definitely, it's important to see any GI doctor who can
Mm-hmm.
take a look with a camera and see what's going on with an upper endoscopy while the patient's asleep. And the anesthesia is very safe and is enough so the patient is sleeping, but and comfortable, uh, but not so much that it's going to have effect on their heart or cause risk. It's very low risk type of anesthesia. And going down from there, problems swallowing, where the patient has things getting stuck. There are many people who might have things getting stuck and they just try to compensate for it by drinking water, trying to get over it with little changes in how they eat, trying to eat slower. But over time, when people don't seek help for this, it could turn into something more serious when they're ignoring their symptoms. So it's important to have this checked out as well and not just try to compensate for it and say, I'm just going to eat slower. I'm just going to drink water. There's problems with the stomach where people are constantly having stomach pain or are unable to eat because of pain, where they're having nausea, getting full too quickly, losing weight because they can't eat properly, starting to develop regurgitation, things coming up after they eat, nausea and vomiting after they eat. That's just not getting better. And of course, every once in a while, people get a bacterial infection, food poisoning, where they might get sick, they might vomit. Of course, that doesn't need doctor's attention as long as they recover from it, and
Right.
they recover from it within normal amount of time, a couple days. But if the symptoms continue, then definitely it's important to seek help. Going down in the next part of the GI tract, the intestines. So that area of the GI tract, people, when they have conditions there, it could cause diarrhea that's just not getting better. It's not the usual food poisoning diarrhea that'll usually get better, where they might have problems with abdominal pain again, losing weight. And with the colon, it's more problems with bleeding, problems with diarrhea, abdominal pain, severe bloating that is just chronic and not getting better, distension of the belly, and problems with bowel movements, of course, like we talked about before, that are just not improving with simple lifestyle changes, diet changes. So those are some of the most common things that we can see.
So it sounds like that anytime something is happening and it's happening on a chronic level, it's going on for days or weeks, that's a sign that not good.
Correct.
Yeah. I mean, we all get a pain or a this or that, but frequently it's a one and done and you're fine. But if I guess if you're having to, eat Tums every day or after every meal, there's a sign there that you better pay attention to.
Right.
Yeah.
Yeah. That
All right.
people
Well,
tend
and that all
to,
makes sense.
yeah,
That
people
all makes
tend
sense.
to ignore. Nobody wants to have to see a doctor, if you don't have to. But people tend to ignore some of these things over time, and that's when things can start to develop into more serious situations.
So what are some things, some I'll say natural ways of making changes like lifestyle corrections, things like that that might make a lot of this improve?
So in terms of heartburn, it's just simple things like not eating late at night, not eating too big a meal at night, having smaller meal at nighttime with less fat at nighttime, less oily foods at nighttime, having those meals if possible earlier in the day, or at least within 4 or 5 hours of going to bed. And not having too much coffee, although coffee is very good for the liver, and we do have a liver expert at our institution as well. But liver conditions, coffee is good to have in the morning. When people have coffee more later in the day, it's going to cause more problems later. Or if they have too much coffee to drink, it's going to cause more heartburn.
Is
Uh,
it the caffeine in the coffee? If somebody says, "Well, I'll just do decaf," is that the answer, or is it just coffee in general?
that's a good question, Andrea. It's the coffee in general. It's the actual coffee bean that has a lot of molecules in it
Okay.
that can cause people to get upper GI upset, whether it's burning or pain, a lot of different symptoms for the upper GI tract that can happen. So it's just making sure not to drink excess coffee. Other lifestyle changes would be to try to walk after meals and not excessive exercise after meals. It's definitely better to exercise before eating, but uh, not jostling around what one is eating too much right after
Right.
eating. The other things that could be done lifestyle for constipation would be to drink at least half one's body weight in water. So having enough water definitely can help with bowel movements, trying to eat more fiber, vegetables that have fiber in it, like cabbage, kiwis, uh, blueberries, things like that, that are very healthy fruits and vegetables that could definitely help people have better bowel movements. Having cooked vegetables also is very good, but most people don't eat enough vegetables to get their natural fibers. That's going to help them have good bowel movements. And also just getting exercise is going to help as well for bowel movements. And those are some of the things that are good just for natural therapy of the gut.
And you didn't describe anything that seemed unusual or difficult for anyone to do. And yet, I know, especially drinking water, how many people just barely they drink water in their coffee. That's their idea of drinking water. And I know that does not count, guys. That does not count. But yeah.
People
Okay.
do have their cup of coffee, and a lot of people say that helps me go, and that's great. If that's what helps them go every day, then that's fine. It's just if they're not going, if that's not helping them go, then these other things are definitely going to help in most people.
But I thought it was interesting about the coffee because I do think I hear people say, "Well, I switched to decaf, so I think that's better." But now you're saying it's the coffee itself that can be problematic.
Right,
All right,
right. In
that
excess.
I didn't know that.
Right.
All right, so okay to have your maybe a cup in the morning, but those of you out there drinking coffee all day, even if it's decaf, not good.
Exactly.
Not good. All right. Well, what are some treatment options for people that are experiencing issues and they do need to go to the doctor?
So in terms of treatments that we offer for patients who have these movement disorders of their gut, these are people who have trouble swallowing, trouble being able to eat, not being able to maintain their weight, and because of a condition called gastroparesis, where the stomach is paralyzed. So we have different ways of trying to diagnose what's going on by actually testing the movement of the gut while the patients are asleep during their anesthesia, during the endoscopy,
Hmm.
so patients don't have to experience discomfort when they're getting these tests done. And previously, a lot of people had to get these tests done while they're awake, while they could swallow or eat, but we're able to do a lot of these tests now while patients are asleep and able to really determine how the esophagus, their stomach are working. And then if we find certain problems right away, we can treat them, whether it's trying to get rid of scar tissue, causing things not to open properly in the esophagus or the stomach, and we do that by dilating or stretching out the scar tissue using a balloon inside of our camera to stretch things out, open things up so things can flow better, so the muscles and nerves will be able to squeeze and work better. We have patients who have to have feeding tubes, unfortunately, because they're just not maintaining their weight. But it really makes a huge difference in a lot of these patients' lives to have that
Right.
nutrition so they're able to function better and still able to go to work because of they're able to get that nutrition and energy that they need. We're able to sometimes stimulate the GI tract with electricity using gastric stimulator that helps the stomach move better, helps the stomach be able to have better nerve and muscle function, and reduces the symptoms that really interfere with people's lives. And then in terms of the colon and the muscles of the bottom of the colon, it's called the pelvic floor. We have very good pelvic floor physical therapists that help people learn how to relax these muscles that are often too tight and prevent people from being able to get the bowel movement out just because the bottom is not opening properly. So the physical therapists are really able to help people without medicines,
Mhm.
without surgeries, in a lot of cases. In terms of the colon, there are a lot of medicines that can help the colon move better in people who've already tried everything. There are ways of massaging the colon that can help. In rare cases, rare situations, people might need surgery for their colon, but we try our best to avoid that and try to help patients just get their natural GI tract working again. And There are a lack of medicines in this area of GI motility. We do have some, but not as many as other areas of GI, like in patients who have ulcerative colitis and Crohn's, which is an area that I don't treat, but we do have experts in our system in that there are many, many medicines. But in our area, we really don't have enough medicines, and hopefully in the future, we will be able to have other medicines to help patients.
Okay, very good to know. Well, Dr. Weinstein, thank you so much for being with me today and really sharing all this information. And I just want to remind people that there's lots of lifestyle changes that you can make that may improve your condition. It's not always about surgery and medicine, right?
Right,
But if a symptom is persisting, absolutely see the doctor.
right.
That's the important thing to remember. All right, so again, Dr. Douglas Weinstein and all of his information will be in the show description. Thank you so much for being my guest today.
My pleasure. God bless everyone with great health and not having to see any of us.
So remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye everyone, and bye Dr. Weinstein.